Where's my line? As a society, we require professionals to separate their professional life from their personal life. For the purposes of this discussion, the ideas we share about the nature of the professional-patient relationship are organized under 3 separate headings. The first being professional competence and patient consent. The second, professional objectivity and patient trust. The third, professional humility and patient maturity. The first set of ideas we share revolve around the issue of professional competence and patient consent. As a society, we share the understanding that a professional gives competence and a patient reciprocates by giving consent to treatment. In fact, a professional cannot treat unless consent has been given by a patient. This seems like an equal power relationship, but a professional knows things a patient doesn't know, so a patient tends to defer to professional judgment, and the balance of power favors the professional. Step into the shoes of this health professional to explore the relationship between consent and deference. You're stepping into the shoes of a gynecological oncologist. Having just read the results of an MRI scan, you look up. You say, well, the results show tissue swelling. It's amenable to biopsy, but you're feeling okay. Sometimes we don't know what's going on with our bodies. Do you want to go ahead with the biopsy? And your patient says, well, and you respond, well then, we'll refer this back to the urologist. Your patient seems to be holding back. What do you suppose she's saying to herself? As this professional in this situation, were you eliciting consent or deference? Did this patient respond to you as an equal? Let the feelings aroused by this case take you back to a similar situation in your own practice. Step into that situation. Can you relate to the situation from the point of view of both yourself and your patient? Pause and think about that for a moment, and we'll move forward to the next set of ideas. The second set of ideas to be discussed is the relationship between objectivity and trust. A professional is objective about when and how to apply specialized knowledge, and patients reciprocate by trusting professional objectivity. This is the understanding we share as a society. But when patients move from trusting professional objectivity to floundering in vulnerability, they need to know that professionals care about treatment outcomes. Step into the shoes of this young cardiologist who is doing rounds on the general ward of a small-town hospital to explore the relationship between objectivity and caring. You walk into a room where a 90-year-old woman is sitting up in bed enjoying the company of her 5 grown children. She looks at you. You nod and stand off to the side. After a moment, you shrug and walk out. Standing in the shoes of this professional, you shrug and walk out, probably frustrated because you can't do anything. Step back into your own shoes and take a moment to think about this. Have you ever been moved to stay present for someone even though you couldn't do anything? What did staying present mean to that person? Was it something like preserving a moment of joy with her children? What did staying present mean to you? Was it a sense of caring within the culture of scientific objectivity? Think about this for a moment, and then we'll move on. The third set of ideas related to the concept of professional-patient relations is the ideas that revolve around the issues of humility and maturity. Professional humility and patient maturity. Again, it is our understanding that a professional's humility about his or her scope of practice and skill empowers patients to explore options and make choices. But a patient sometimes loses the ability to hold on to the role of consenting adult. Then a professional may have to step into the role of adult authority figure. So professional humility morphs into authority as patient maturity morphs into childlike behavior. And repeating this pattern often enough, a professional can begin to move towards authority fairly quickly when faced with any hesitance on the part of the patient. Step into the shoes of this health professional, a chiropractor in private practice, to explore the relationship between humility and authority. An accomplished young athlete who has been your patient since childhood comes to you frightened, saying she's been diagnosed with breast cancer. You tell her a healthy spine helps anyone face whatever has to be faced from the strongest possible position. She's been coming to you for spinal adjustments several times a week since you told her that. You haven't yet asked her what else she's doing to deal with the diagnosis. Is it possible that in her vulnerability your patient has developed a childlike dependency on you, you whom she has trusted since childhood to act in her best interest? Are you obligated to find out what other options she's pursuing, if any? Will you encourage her to return to her medical doctor if she has not done so? Let the experience you have with this case take you to a similar experience in your own practice. And pause for a moment to think about how you manage professional humility, patient vulnerability, and professional authority. Think about this for a moment, and then we'll move on. We opened by saying that society requires professionals to draw a line between their professional lives and their personal lives. We went on to discuss this idea and the reasons for requiring the line under the three headings: professional competence and patient consent, professional objectivity and patient trust, professional humility and patient maturity. We then explored these ideas through case studies. Having done this work, we are now in a position to draw a conclusion, and that is that professional-patient relationships are complex and volatile. Just taking a single example, a professional can be dealing at one moment with a consenting adult, and in the blink of the eye, that very adult can transform into a frightened child. As volatile as these relationships are, they are best kept separate and apart from personal relationships. This concludes part 1 of a 2-part series entitled Where's My Line? Part 2, Staying Under the Professional Hat, is also available.